different buckets, if you will: diagnosis and treatment, and even preventative. I think one of the goals with healthcare, particularly in the United States and around the world, is we must get upstream on healthcare into true healthcare preventive care as opposed to sick care. And I think AI will help take us upstream, further upstream, and from a preventive standpoint. I like personalized medicine a lot, to echo Nicholas. I'm not only excited for what it will do for populations and individuals, but when I think about healthcare, and I remind my colleagues and employees and staff all the time, we're all patients and consumers at the end of the day. We all have a stake in this. We're all going to benefit from this. And when I think about personalized medicine, having had a father who died at a young age from lung cancer, I think about how amazing will that be to continue to customize treatment plans for patients who have different illnesses and likely impacting the outcome. So very excited about personalized medicine. We're going to see a lot of growth, continued growth, I should say, in that regard. A few other areas that, I think a lot about in AI as it relates to healthcare is certainly image analysis, as you're both aware of. We'll continue to see major inroads in radiology in terms of X-rays, CTs, and MRIs. Not only the ability to help with errors and to catch things that a human being may overlook, but also the sheer volume of data that imaging will be able to process through imaging. That goes for pathology too. Pathologists are some of the brightest minds in healthcare. They have very difficult jobs discerning different patterns with regard to cellular architecture. And I expect, again, AI will support them, augment them, and it will allow them to do a lot more based upon the sheer volume of data that it will process. Another area that I'm very bullish on, if you will, is remote patient monitoring. We continue to see a transition in the US from inpatient care to outpatient care. That will continue to be made possible by continued inroads and advances in the remote patient monitoring category, which includes wearables, of course. And then quickly, I'll just add from a treatment standpoint, and I'm happy to come back to any of these, we'll continue to see advances and support in the surgical suites with regard to AI and what it's doing there. And something that's very important to me, another area that I think not only can the US use more of, but the world, and that is mental health. There is a shortage of mental health services and providers in the US, and our ability to leverage AI to augment what we're doing in mental health will help significant populations of people.